Good evening. You're on the smoking section, and tonight I'm very pleased to have a guest, which we don't always have. And tonight we have Jess Cochran. Welcome, Jess.
Thank you for having me.
And Jess is a public health lawyer with a focus in drug law and policy. And Jess, as we were talking, I think have you been involved in the anti-smoking campaign or smoking public policy? When did you first get involved in that, or when did you interface with that?
My first foray into the debate around anti-tobacco policies was when Northeastern University in 2013 proposed a smoke-free campus policy and held a series of public forums on the topic to get feedback from community members. And at the time, I was the president of Students for Sensible Drug Policy at Northeastern University School of Law. SSDP is an international grassroots organization of students who are opposed to, who are concerned about the impact of the war on drugs, not just in terms of drug abuse, but also the policies that are designed to address it. And so at the time, I came together with some of the other members of SSDP on campus to ask the university what it was planning to do to support people who were unwilling or unable to quit smoking.
Right. And did the university respond to you in any kind of meaningful way?
Well, I'm not sure that they expected anyone to actually oppose the smoke-free policy.
Oh my gosh.
But at the time when we did, our main focus was on getting support for smoking cessation. So for the community members who would not be able to immediately quit smoking to come into compliance with the policy, we wanted to know, well, is the university health and counseling services going to be offering free readily accessible cessation support? Are they going to be handing out nicotine patches? Are there going to be support groups? What will happen if someone is in violation of the policy? These are the kinds of questions that we were asking.
And how did they respond? Did they give you any answers?
We, several months after the forums, they did come out with a program that is called Ready to Quit, and they are marketing it more. They're increasing visibility to encourage students and other community members, such as faculty and staff, to take advantage of this one-on-one smoking quit support program that they've put into place. So I would like to think that our efforts, SSDP's efforts, to encourage the university to think about cessation actually led to the implementation of this program.
Well, at least you spoke up. And were you at all surprised that, for example, there were not other people on campus who opposed this, either because they enjoyed smoking or because they felt this was overly nanny-state-ish? I mean, aren't there any libertarians on the campus, or not necessarily libertarians, but people who believe in life, liberty, and the pursuit of happiness, let's say?
So was I surprised?
Yes.
I'm sure that there are such folks on the campus. I'm not sure that many of them felt that they were willing to go to bat on this particular issue.
Right. But the university did provide a forum for people who were willing to go to bat.
From what I recall, the folks who were in the forum were primarily the Health Disparity Student Collaborative.
Is that right?
As well as SSDP on the other side.
The Health Disparity Health Collaborative. Is that a group?
I think it's called the Health Disparity Student Collaborative at Northeastern, and they were in support of the smoking ban.
Right. Because that's an interesting question, because there are people in the public health profession who are very concerned about how the tobacco taxes are affecting poor people and people with mental disabilities, primarily because those people have very high rates of smoking, and these taxes are, at least in the view of some people in public health, are impoverishing these people. Now, my question is to you, this group that you mentioned who's interested in health disparities, I would think that people who are interested in health disparities would be concerned about the regressiveness of tobacco taxes.
I would think so. We did raise the argument that there are populations who have higher rates of smoking, as you mentioned, those who are of lower income, LGBT folks, people with mental illness, as well as international students was
Right.
one body of folks that we were concerned about. And I remember saying at a forum, well, what about all of those students who are coming from, say, China, where it's very commonly accepted to be a smoker, and who are now going to feel unwelcome here at this university?
Yeah, right.
And the response that I got from the dean was actually to say, well, shouldn't we care about their health too?
Oh dear, yes, right. So in other words, ostracize and alienate them for their own good. Yes.
Yes.
Jess, we have a telephone call. I don't know what it's going to be. Shall we take it?
Sure.
Sometimes they're crank calls. That's us. You're on the smoking section. Oh, maybe a problem there. Maybe a problem there. Well, so you didn't get, okay, so this was from the dean. Did the, you know the Public Health Advocacy Institute?
Yes. Mhm.
They must have really been all over this,
Yes,
right?
they were in full support of the
Absolutely.
smoke-free campus policy.
Any particular individuals over there?
Not that I recall, no. I think that there is a very narrow definition of what is health in this view. And to me, health includes the health of people who aren't able to quit smoking, who choose to continue smoking. That there's no reason to say we no longer care about your health because of this choice that you're making. We don't say that to folks who eat unhealthy foods, for example.
Right, but they would say, what their big argument is that, for example, people like me, I am killing probably hundreds and hundreds of people in my life with my secondhand smoke, endangering.
Outside?
Oh yeah, well, the inside and outside, but these days even outside, like someone like me, like I'm almost like a mass murderer, you know, because I've been smoking, you know, because my smoke is killing, you know, just, well, I don't know, about hundreds of people, but that's what they would, so they would almost kind of probably equate me with a serial killer.
Well, that's a bit hyperbolic, Stephen.
Well, I mean, come on, they say that 50,000 people are killed a year with secondhand smoke.
I do think that it is reasonable not to have smoking indoors.
Yes. Mhm.
I, however, believe that the effect of secondhand smoke in an open air environment has been overstated.
Right, right. And have you, so this policy was implemented. Let's see if we can get this phone call out of the way, Jess, all right?
All right.
And without losing our, what do you call that? Track,
Momentum.
mental track. You're on the smoking section. I have a few.
Yeah, wait a minute, let me mute this.
Is this Jim? Do you have your television on?
Steve.
Do you have your television on, Jim?
Yeah,
Oh, I think you got to turn it off.
yeah, I did.
Okay, you're
But,
on with Jess
Smoking
Cochran.
really is a disgusting habit.
Yeah.
And it definitely kills people, thousands every year, Steve.
Okay, is that your point? Jim? Okay, well, all right, Jim is a frequent caller, and sometimes he agrees with me about something I'm saying, and sometimes he disagrees with me, but he brings up a point. And I guess the point could be expressed is, according to anti-smoking activists, smoking, 450,000 people die from smoking a year in the United States. So given that carnage, if you will, you know, is there any, let's say, is there anything that the government should not do up to and including maybe incarceration or, let's say, quarantining people like me? Because when I walk down the street and I smoke, like younger people see that and they say, look at that cool dude smoking. I'm going to start smoking too. So like it's a contagious, you know, you've heard of the contagion theory of behavior. You know, people see me smoking, unwary youth, you know, who have not been educated. You know what I mean? To the dangers
do those
of
still
smoking.
exist?
Well, you know, according to anti-smoking activists, they do. But I mean, is there anything that they shouldn't do, up to including quarantining people like me and incarceration, hanging all the people who produce cigarettes, etc.?
Well, for one, tobacco is not an illegal product.
Right.
So how could anyone be incarcerated for the use of something that is legal
Right, at this point,
at
anyway.
this point? Mm-hmm.
Well, you could also say that anybody who smokes must be crazy, so you could involuntarily commit them. I don't think that's going to happen too soon.
I should hope not.
Let's take one more phone call, but I want to get back to, you're on the smoking section. Welcome.
Yes, excuse me. I am a former smoker,
Yes.
but I am suffering, but I'm not dying of lung cancer.
Yes. I'm
But
sorry to hear that.
I am pro-smoking, but to a point. Only because of what happened, what I call the fiasco, when the people from, say, Marlboro and all of them went down to Washington, stated their cases, and what have you. People came forward, said they died from cigarette smoking, this, that, and the third.
Yes.
Well, I'm here to say you don't necessarily die from cigarette smoking. First of all, you can walk across the street and get hit by a truck or
Right.
what have you.
Yes. Well, listen, I'm going to ask Jen to comment on that. Jess, excuse me. Thank you very much for calling the smoking section.
Yep.
Well, I mean, that's another thing. Do people have the right to really navigate their own ship of life, as it were? I mean, that's an important, I think there are people in public health who don't believe that.
In my opinion, the most effective means of ensuring the public health come from prevention, education, and support services. However, because the public health infrastructure has been underfunded for so long,
Yeah.
I think there are many in the public health community who see outright bans and prohibition as a faster way to the result that they see as the healthiest.
Yes.
And therefore they are quicker to choose prohibition as an option because they feel that they don't have the ability or the resources to put in to education, behavior change, and other ways that might be more effective in the long run and less stigmatizing.
So you think actually there are people in public health who, let's say, are using stigma, bans, high taxes, not as a first choice, but as a second choice?
I do think that. I do think that there is a sense that if we had everything we could have, if we had all tools at our disposal, then yes, maybe we would resort to less coercive, less stigmatizing and alienating methods. But because we are so strapped for funding and resources, that the only thing we can do is to ban and use these sort of punitive
what is
methods.
that word? Velvet glove, iron fist, in a
Right.
sense.
Mm-hmm.
Yes. Let's take one more call, but I would like to get on with our conversation for a while. You're on the smoking section.
Hi, Steve. This is Paul Neff.
Paul Neff, how are you? Welcome to the smoking section. Jess Cochran.
Hi. I just want to run something by Jess and you,
Okay, well,
and the audience.
I'm going to try to stay out of the way.
Huh?
I'm going to try to stay out of the way and give Jess some moments to talk. So respond in any way you feel.
Okay. Can I say my thing real quick?
Why not?
Okay. I'm 61 years old, and so I've been observing the war on smoking for decades. And one thing that really strikes me when I go out and take a walk and observe people is that to this day, you can still see intelligent-looking, professional-looking people that smoke, people that are indistinguishable from you or a kindergarten teacher or even a politician. And and the fact that there are still like roughly 20% of the population smoking, I don't understand why the anti-smoking movement doesn't reassess its tactics, because they're obviously, I mean, like, if everybody took all their claims seriously, you would not be able to find an intelligent, normal smoker these days, whereas in fact they are quite plentiful, and I'll leave it at that. I want to see what you guys have to say.
Thank you. Jess, could you respond to that? Does that strike a...
Yeah, it does, actually. I think that the anti-tobacco movement can take can take a tip from what has been learned in the anti-drug movement, which is that prohibition doesn't work, and zero tolerance policies are unrealistic, and it's completely ludicrous to try to say that the goal is zero drugs, zero smoking. There's always going to be some section of the population that is going to partake in mind-altering substances, that is going to use tobacco, that is... Therefore, you cannot have that as the end goal. That is a fantasy world that has no manifestation in reality, and our policy cannot have that as its target.
Because, well, I mean, I think Paul is right. I mean, there are young people now who have been weaned on anti-smoking education. There are people who you cannot say are necessarily suffering from mental illness or are in some kind of dire poverty, who are smoking out of desperation. They just choose to smoke, and evidently they don't believe, or they don't want. And what do we do with those people? I mean, do we allow them to live, or do we do everything we can to interfere with their lives as public health, as a public health?
I think we live and let live.
Aha.
I think as long as they're hurting no one else, then there should be no interference with the personal autonomy.
Okay, Jess, you did some, I wanted to get to this business about the Cleveland Clinic and some of the legal issues that are raised here. And, but I copied this, I printed out this, I don't know what you would call it, manifesto by the, well, what's not really a manifesto.
It's really just a brief on employment law issues
by
tobacco, by a firm that does employment law.
No, I thought this was, I thought these people were representatives of the Cleveland Clinic.
I think you may have been mixing up documents.
Am I all confused?
This is the cover of an employment law quarterly.
Is that right? Really?
Yes, but I don't recognize this document.
Oh, no, this is a different document. This is a document by the American Civil Liberties Union regarding,
Okay.
So-called lifestyle discrimination.
Right. There is a trend recently among employers, particularly healthcare employers, to go beyond even smoke-free and go and move towards smoker-free workplaces.
Right. And one of the predominant
sort of the pioneer in that area is the Cleveland Clinic.
Well, I mean, there are other places. There is Scott Miracle-Gro, the Scott company.
I didn't know that.
Which is a big national, you know the company I'm talking about.
Also Alaska Airlines.
Yeah, I don't want to hear too many of them because it gets me too depressed, frankly.
There are quite a few and more all the time.
Right. But we do have 29 states which have some laws against this.
Correct. There are a number of states that have either general prohibitions against employers making hiring or firing decisions on the basis of behavior outside of work,
Yes.
which can include smoking. Some of them are also tobacco specific.
Right.
However, Massachusetts is not one of those states.
Unfortunately. Scott's Miracle-Gro, or Scott's company, had some litigation where a smoker was fired.
Ah, yes. Now
About 10 years
I know
ago,
what you're
I
speaking
think.
of. It was the Rodriguez case. I
Yeah,
believe.
you've seen that. And the court decided in favor of Scott's Miracle-Gro.
Well, they dismissed all the claims. They did not decide it on the merits. They dismissed all of the claims that he brought against the
Because they felt they lacked...
They did lack merit.
Oh, they lacked merit, because, meaning that he could have been fired for other reasons or something like that.
Yes, I believe that he had brought some claims under ERISA, which were inapplicable. He had brought claims under Massachusetts discrimination law, which were clearly going to fail. And the only claim that did have some validity to it was under the Massachusetts privacy laws.
Yes.
And I believe that they found under the facts of that case, which were such that the employee had made no secret of the fact that he was a smoker.
Right.
There was no claim to be made that his privacy had
Okay,
been
let me ask you a
violated.
question. So you studied this case?
I've read about the case.
You've read about the case. Okay. Now, I'm going to take one more call and that's it. Okay. Thank you very much for calling the smoking section, but we got to get to some dense stuff. You're on the smoking section. Welcome.
Hi, Steve. This is Paul again.
Paul again. How are you?
Yes, I just have. Wait a minute. Now, what was I going to say? I had one quick comment. Oh, yeah.
Please.
That, well, on the one hand, and this is for Jess, it's kind of a question, kind of a statement. You know, we petition every day against the patio smoking ban, and so we get to gauge the attitude of the public.
Yes.
And there's a major disparity in that, on the one hand, groups and businesses and companies and people with power they're continuing to embrace these coercive measures. But on the other hand, the public, it's very hard to find anybody that has as extreme a position on smoking as these authorities. And I don't know if it's a tipping point thing, you know, but people seem to be catching on. You know, like after 13 years of bans and
All right, thank you
escalating
very much,
taxes
Paul.
and things.
Paul is of the opinion, and he's a colleague of mine in Cambridge Citizens for Smokers' Rights, and he is of the opinion that the anti-smoking movement is overplaying its hand, and that the public, many of the public, are beginning to seriously question how far it's going. Do you have your finger on the pulse of the public? Do you have any ideas on that?
It does seem like the push towards more regulation of a more tobacco policy that's restrictive, it is kind of reflective of the whole criticism of the nanny state.
But do you think that that's getting any traction? Do you think they're overplaying their hand? Are you just hard to judge from your perspective?
I guess overplaying their hand in the sense that they are inflating the risks associated with smoking or sensationalizing them? Is that?
Well, I mean, Paul thinks that the public is becoming fed up with the anti-smoking movement.
I could see if that happening. Mm-hmm.
Yeah, I mean, we have a very divided public in this country right now.
Mm-hmm.
You know.
I mean, part of American history, some of the values that our country was founded on is personal liberty and autonomy, and,
Yes.
and freedom from government interference. And so, to the extent that these policies come up against that, I do think that the public is wary of them.
Wary. I certainly hope so. I mean, that's the whole point of Cambridge Citizens for Smokers' Rights.
Yeah.
But listen, the U.S. Okay, so this is from this document, whatever document it is. The U.S. Centers for Disease Control and Prevention, which, by the way, the director of the CDC is now Thomas Frieden, who was Michael Bloomberg's public health commissar. Okay, if you don't mind me saying that. So he's definitely zealous, very zealous. So the CDC says that businesses lose approximately $3,400 each year for every employee who uses tobacco because of increases in health costs and decreases in productivity related to smoking breaks. Do you have confidence in the CDC's statistics, or do you suspect, as I do, that many of these are tweaked to deliberately incite actions against smokers?
I feel certain that that statistic is probably inflated. That I believe that there is a study that found that smokers take more sick days or perhaps have higher costs in healthcare. However, I think it's rather silly to single out smokers as the cause of inflated healthcare costs, or to say that well, because smokers are engaging in a behavior that ends up being more costly to the employer, that we should be acting punitively towards smokers, whereas there are so many other behaviors that may be riskier to
Drinkers,
health.
motorcycle riders.
People who eat McDonald's every day, for example.
Motorcycle riders, people who are
Perhaps we should
promiscuous.
Right, perhaps it asks the question of should we be then making all of those inquiries into our
Yeah,
employees' health
right,
as well?
right, certainly. And why?
And are we willing to do that?
Okay, Jess, can you explain a little bit? We only have about a minute left.
Mm-hmm.
In 45 seconds, which is more than you think. Can you explain a little bit about how the ADADA may open the door to something that I would like?
An act amending the Americans with Disabilities Act was passed in 2009, and this act expanded the regulatory definitions of what constitutes a disability in order to be able to claim disability discrimination under the act. Because it expanded this definition, there is an argument to be made that prior cases decided under the more stringent definition would no longer be applicable, and that there may be an argument that smoking, or more accurately nicotine addiction, could be, like alcoholism, a disability under the Americans with Disabilities Act.
Jess, thanks for coming on tonight.
Thank you for having me.
Thanks for watching the smoking section.